Hi, I am Dr. Srividya, Consultant Obstetrician and Gynaecologist at Cloudnine Hospitals, Bellandur and Sarjapur Road. I would like to brief on one of the very common symptoms of early pregnancy, that is morning sickness. So morning sickness is the sensation of nausea and vomiting experienced by 70 to 80% of the pregnant ladies in the first trimester. It typically starts around 6 weeks, peaks around 9 to 10 weeks and then gradually subsides by 16 to 18 weeks. Despite the name morning, it can happen at any time of the day. Now, why does it happen? As soon as a woman becomes pregnant, many hormones are synthesized in her body, like huge amounts of estrogen, progesterone, beta-HCG, relaxin, and so on. Some of these hormones directly stimulate the vomiting center in the brain and cause nausea and vomiting, whereas some other hormones impact on the gastrointestinal system. They delay the gastric emptying, causing gastroesophageal reflux, which in turn leads to nausea and vomiting. That is the reason it is much more seen in women with multiple pregnancies like twins and triplets, because the hormones go to very high level in them. Apart from hormones, women who are more likely to develop this morning sickness are who had history of migraine or who had previous history of motion sickness are more likely to experience these symptoms in pregnancy. At the last, stress is an important factor which can also trigger morning sickness. How to overcome morning sickness? There is no such remedy which can give an instant relief or a complete cure for morning sickness. We should understand some facts related to it. Make the pregnant lady realize that it is a part of normal physiology of pregnancy, and never stop eating food for the fear of vomiting again, because empty stomach always triggers acidity, which in turn triggers vomiting. So it becomes a vicious cycle. So she has to break this cycle by eating in between. Caregivers should understand that the appetite for a pregnant lady decreases for many of them, and there is a lot of alteration in the perception of taste and smell, which makes them uncomfortable for many of the foods which she was taking well before. She will not be able to do the same. So they should not make her force and eat each and everything which they feel healthy. Let us discuss some of the home remedies to overcome this. Try to avoid long gaps between the meals and encourage the lady to eat small frequent meals. Avoid oily and spicy food. Let her include sugary diets like simple sugars for better and easy digestion. Substances like ginger, mint or lemon-based drinks or candies are encouraged to be taken in the very early morning so that the nausea and vomiting sensation can be reduced to a better extent. Avoid triggers like strong smells and odors. Let her munch some dry crackers or dry biscuit or a toast before getting down from the bed to make herself ease with the nausea and vomiting of pregnancy. Keep herself well hydrated by sipping small amounts of fluids like water, coconut water, glucose water or ORS sachets rather than gulping in large amounts for better tolerance. Encourage her to come out of the room, go for a morning or an evening walk and let her breathe some fresh air. Despite the home remedies, if the symptoms are severe, please consult your doctor. She will prescribe the medications which have a better safety profile in early pregnancy to overcome the situation.